Let's begin performing documentation on a new admission. We'll set the stage for our patient. This is an emergency room patient, approximately 75 years old, being admitted to the ICU with a diagnosis of acute shortness of breath, pneumonia, new onset of confusion for rule-out CVA, known diabetes, congestive heart failure, also identified as having a stage 2 pressure ulcer to the right hip, and is currently being restrained with soft wrist restraints. We'll begin documentation for our new admission process by building our plan of care. Remember, the patient care management profile is designed around the plan of care, which automatically then will populate associated flow sheets for admission. Always start by using the Add a Care Set hyperlink at the top of the well. Selecting Add a Care Set, we'll use the drop-down menus to initiate our assessment. Every patient should be initiated on admission with hospital standards as well as standards of care for the unit to which they're being admitted. To search for hospital-wide standards and unit-specific standards, simply use the drop-down field or the search field above. By typing HOS and clicking Search, we can populate the well below with hospital standards as well as unit and hospital standard combined care sets. Or we can use the drop-down menu, select Nursing. In the sub-menu, select Standards, and in the well below, the same standards will populate for your selection as well as other care sets. Note you have the ability to select individual care sets for hospital standards for nursing care documentation, as well as care sets for unit-specific standards, depending on the unit they're being admitted, or joint care sets for unit and hospital standards. This makes it very easy to use the click of one button to populate both unit and hospital standards into your shopping cart to the right. We'll use that method now for speed. Selecting the button, the unit and hospital standards populate our shopping cart, just as if you were performing an order entry process. You have the ability now to review the standards and remove any standards or care sets or outcomes or interventions using the trash can option that don't apply to the patient. We can scroll down our menu and eliminate a couple items that we know right away don't apply to our patient. For example, 12 to 18-year-old interventions, 18 to 44-year-old interventions, and 45 to 65-year-old interventions do not apply to our patient. We can click the trash can now and eliminate those. We also have the ability to simply use the Review Selections tab of the shopping cart and populate all items in our shopping cart into another field to perform a more detailed review of our selections. We'll go ahead and do that now and eliminate a few more items prior to saving them into our patient care management profile. So now you can see that these items for hospital standards of nursing documentation as well as unit standards for nursing documentation have been listed as care sets in our well. Remember, to view outcomes and interventions that are automatically tagged to these care sets, use the tree plus symbol, clicking the description to open all care sets below. Now we'll simply use our menu bar to the right, scrolling down to review each of our care sets for appropriateness. Again, these are hospital standards and unit-specific standards, not necessarily specific problems identified with the patient on admission. We'll add those in a few moments once we've completed populating our hospital standards and unit standards. You can see that there are ADLs, the admission data and history, admission screen, belongings, review of the care plan, transfer summary when appropriate, comprehensive assessment every shift, discharge planning, scrolling down, education with associated outcomes and interventions. Again, we can eliminate the age groups that do not apply to our patient using the trash can to the right. We'll do that now. Next we have intravenous lines. Scrolling down, pain assessment, risk for infection, as well as risk for impaired skin integrity. And then finally, at the bottom, safety. We'll eliminate a couple more things prior to saving our care set. We'll identify that the patient has an intervention for assessing shackles. We can eliminate that using our trash can since our patient is currently not wearing shackles. And we can scroll down and also eliminate at this time the intervention for seizure precautions using the trash can. And this is just an example. There are a few others in our standards for care for hospital-wide as well as in unit standards down below that we could probably eliminate or change. For the purposes of demonstration, we'll just move forward. Note also that your schedule for each of these care sets is a hyperlink. That means that you have the ability to individualize these schedules now. By clicking the hyperlink next to any care set, you open the schedule and you have the ability to make changes in terms of the frequency of the observation or documentation associated with that problem or care set. This particular problem or care set is the admission data and history completed within 24 hours. This, of course, should be continuous. We'll go ahead and leave it as it is and cancel. And we'll click Save to populate these two care sets for hospital standards as well as unit-specific standards for the ICU into our patient care management profile. It is necessary on admission to populate the hospital standards and the ICU or unit-specific standards separately before adding additional problems associated with your admission. The MS4 clinical program can only handle transfer of so much data at one time. Attempting to load additional problems into your plan of care associated with hospital and ICU as one complete transfer will bring a pop-up window that asks you to do them individually or one at a time. As you can see now, we've got associated flow sheets attached to the right next to each of the appropriate care sets. At this time, we'll view the outcomes and interventions automatically attached to these care sets by clicking the plus symbol and opening the care set trees. All trees below will open and you'll be able to identify outcomes and interventions. Scrolling down using the bar to the right, you have the ability to individualize any outcome or individual assessment or intervention associated with a particular care set. Simply clicking on the hyperlink will open the care set and allow you to change the status or add information. We'll demonstrate that now by selecting a couple of care sets to open. We'll start with discharge planning. By selecting the heading for the care set under discharge planning, if we change the status here to pending and click Save, a pop-up message will appear to let you know that all goals and interventions below the heading will also reflect that status change. This is not, however, the case when selecting a status change for individual outcomes or interventions. Only that status change then will be reflected. However, when selecting the main heading of the care set and changing the status there, all orders or outcomes or interventions will also reflect that status change. We'll click OK now, and now you can see in your patient care management profile that discharge planning is showing pending for all outcomes and interventions below. Scrolling down, we'll select the tree for education. By clicking on the plus symbol and opening the tree, any goals or interventions associated with education can be viewed. We'll scroll down and identify a particular goal or intervention perhaps that we want to either eliminate or